So, welcome to another episode of Head First with Dr. Hill. Today's guest is Dr. Lobsang Rapgay. Dr. Rapgay is an adjunct assistant professor, research and clinical psychologist in the Department of Psychiatry at UCLA. He was the director of behavioral medicine clinic and the program and assistant clinical professor at UCLA Semel Institute UCLA for over 6 years. He's currently studying the behavioral and neural correlates of fear re-consolidation. So thank you, Dr. Rapgay, for being here with us today.
Thank you for having me. Thank you.
So I've known you for a few years. I was a grad student at UCLA and got to sit down and over many a meal and discuss neuroscience and different aspects of things where our interests overlap. But I'm sure to many of our listeners, they don't know you. So if you could please give us a sense of who you are, where you came from, what brought you to this point in your life today.
I was born in Lhasa, which is the capital city of Tibet. And actually I was born in very near the central temple, which is regarded as the holiest site in Tibet, actually. So it's considered a privilege to be born near that site.
Did you plan that?
Not quite, but that's so. I was raised there in Lhasa till I was about 6 years old, and by that time, when I was born, and around that time, the Chinese communists had already come into Lhasa. They came in from eastern Tibet, and then they were already in Lhasa, but they were not at that point occupational force. They had come to under the guise of helping the Tibetans, but there were already simmering tensions brewing in the air. And so it was in that environment I was born.
Yeah.
And my parents were already thinking of what should we do? Should we stay or leave? And finally then I left. Then we escaped into India, where luckily I was able to go to a boarding Catholic school, actually a Jesuits Catholic school, where I received most of my high schooling, and then eventually I went to university in India, and then finally around that same time my father passed away, and I used to be very much a reflective person by nature, so I always was drawn to the inner experience and the world, and so that, coupled with the passing away of my father when I was very young, kind of somehow drew me to the monastic community, which I remained for about 18 years. And while I was a monk, I eventually decided to complement my monastic training with looking into Western psychology. I already had a PhD from an Indian university where I studied Western and Eastern psychology and philosophy. So I had some exposure there. And then finally I decided to come to the United States to pursue a degree in clinical psychology. And then when I was done with that round in 2000, I began to work at UCLA as a staff psychologist.
And that's a research position or clinical? Were you doing?
That was predominantly a clinical position. There used to be a consultation and liaison services under psychiatry, and that was a service that provided psychiatry and psychology to interface with the medical doctors from various disciplines and provide complementary services to psychiatric and psychological services to medical patients who required maybe psychiatric help, primarily medication, but secondarily psychotherapeutic, short-term psychotherapy.
And of course, you remain involved in both the therapeutic, the delivering therapy one-on-one, as well as researching into some of these neuroscience and psychology topics.
Right. Well, actually, after that, I became a assistant clinical professor, and I directed a outpatient clinic. We started the behavioral medicine clinic, which provided training in behavioral medicine, such as in hypnosis, peripheral biofeedback, and cognitive behavioral therapy, to help work with patients who had predominantly a medical condition, but who require they had secondary anxiety or depression, which we try to help them with, including pain.
Interesting. I want to ask you more about that, but before I do, could we go back to your early life? I'm really curious about what the experience of joining the monastic community, taking vows. What was that like for you? How old were you in that process, really, when you committed to that?
I was about 20 years old.
Okay. So not a child, but still not totally formed.
No, absolutely. It was kind of in a place where I was thinking of going abroad to pursue my Western academic interests and studies, and I had to make a choice. And so I went that and decided to pursue a monastic training. And what happens is, first you have to take a vow as a novice, which is a commitment of 36 different vows.
Okay.
And then as a novice, you kind of evolve into the monastic life, which is, there are a lot of prohibitions. It's a celibate lifestyle. Sure. And also on a day-to-day basis, you have to observe a lot of rules and regulations. And I went primarily into a monastic school, which was very academic. It's very much like the Jesuit schools.
Sure.
Very philosophically oriented, and dialectics was the means through which you pursued the philosophical understanding of
inquiry,
Buddhism.
Essentially.
The Tibetans derive their dialectics from Aristotelian. Yes, it's a derivative from that tradition. So they use very much syllogisms like, if there's smoke on the hill, right, or a mountaintop, is there fire?
Right.
And you debate that endlessly, and that's exactly a example of what we used to debate on in our early grades. That was the focus of the debates, where you learn the dialectical basics, and then it evolved into a pursuit where you looked at more Buddhistic themes and concepts and theories. But along with, so it was a very rigorous, schedule, very disciplined. We used to get up around 5 o'clock. Then we had a service where it was a confessional service, where we did prostrations and prayers as a form of confessing any oversight in one's behavior the day before, and that would go on for about 1 hour or so, and in between breakfast was served during that prayer session. And then there would be, you had to do your homework, which involved a lot of memorizations of texts, along with learning dialectical skills. And then there would be classes, and the afternoon 2 to 3 hours would be spent in individual debate classes. And then there would be another period of time where you would do your homework and practice individual practices. And then there would be a late night prayer followed by long hours of debate, sometimes lasting till 11, 12 o'clock in the night. So that was on a daily basis. And then every month there would be a night-long debate. That means it starts around 6 o'clock in the evening, and it goes till 4 o'clock in the morning for the entire night.
Which is about when you were getting up anyway.
That's right.
So. Interesting.
That's right.
And this is all in preparation for sort of becoming a monk? Or
this is more academic training, but also in the meantime you are learning to familiarize yourself and becoming habituated to being a monk and what its life is. And if you feel it, that's what you want, then you become a fully ordained monk, which involves taking 253 different vows. So that's a lifelong, and it's in our tradition of Tibetan Buddhism, it's a lifelong commitment.
Mm-hmm. And so once you clearly embraced those vows and committed to that, what was your life like at that point? I have no sense really of what a Tibetan Buddhist monk does with his or her time beyond meditate, study. What else do you do?
Not much. I mean, it's predominantly in our school of Buddhism, it's very academically driven. Mm-hmm. And then between every 2 weeks, there are public confessions that you attend to. And actually, while we say a lot of prayers and do a lot of memorization, the bulk of the time is spent on academic, dialectical learning and debating. Yep. And meditation is something that comes much later, actually, in our tradition. Huh. The idea is that you learn the theory of mind, the different components of your mind, and you define them and learn to discriminate one mind from the other and learn things like discrimination skills, learn the difference between categories as well as a specific item that belongs to a category. Learn all these different basic cognitive and a broad theory of mind, and then debate them out so that you really integrate at least analytical understanding of them. Yeah. And then after 10, 15 years, you begin to meditate. That's the kind of structure in our school.
Yeah, certainly. I mean, I have some understanding of Buddhism. I practice meditation, but really no understanding of that traditional, cultural inflection. One thing that I've always noticed in general, sort of Buddhism is there seems to be a bit of a difference between the lay person who's engaging with the world and practicing ways to reduce their own suffering of those around them through, meditation, through not being attached. How is the more rigorous practice of the monastic community different than the lay community in Tibet? Is it dramatically different? Are there...
Yes, it is. It is.
Different practice of Buddhism?
And different way of integrating Buddhism. In the lay community, it's devoid overall of the academic depth understanding of the mind. So it's more devotional and belief-oriented. So the lay person might see the Buddha as a divine figure.
So more cosmology and less technique.
Right, less technique. And the expression of their practice would be in the form of prayer, offerings that they would make to the monasteries or the monastic communities. And then they might do practices themselves, like not only prayers, but they would do prostrations, or those who are more deeply involved as a layperson, then they might do long retreats into the more esoteric form of Buddhism.
Interesting.
But practices such as mindfulness, shamatha, is something that in the Tibetan Buddhist tradition, both in the lay and the monastic community, you don't find that many practitioners. They tend to do the more esoteric practices of deities and make what we call deity practices.
Now, these sort of visualizing different deities and specific chants or specific mantras or mandalas you're visualizing.
That's right. In Buddhism, there are like it's good to think about three types of Buddhism. The one that the Buddha taught would be the Theravadan type, which is based on the concept that there's only one Buddha, and that's the historical Buddha. He was a human who practiced shamatha first, which he learned from the Hindus, and then on his own he decided that was not enough, and then he began to integrate Vipassana to Shama as an extension of Shamatha, and that through that he became enlightened.
Now, is this Siddhartha Gautama Buddha or
That's
somebody?
right.
Okay.
They only acknowledge one Buddha.
Uh-huh.
Now, and then therefore they focus more their objective or their approach to Buddhist practice, which all the Buddhist traditions except like shamatha practice or concentration practice and insight practice is uniformly accepted by all Buddhism forms of Buddhist schools. But what the Vipassana, the Theravadins approach is different. They focus on individual liberation first before you can help others. You have to, and they do it through shamatha practice, leading to Vipassana, and then complementing that with loving kindness and compassion.
That's wonderful.
That's how it's done. However, the second school of Buddhism, it's called the Great Vehicle or the Great School, the Mahayana. That takes a different approach. They accept all the basic teachings of the Buddha, like the Four Noble Truths, the Eightfold Paths of Practice, but they say their approach is that one should delay one's own liberation in the interest of helping others become liberated. And so the approach is very, very different. And so they focus a lot on using ethical basis is the foundation. Ethical life is the basis of then developing wisdom, which is about understanding the nature of your mind and the reality as such, and complementing that very heavily with compassion practices. However, the third school, which is exclusive or predominantly dominated by the Tibetan Buddhist tradition, is the Vajrayana school.
Vajrayana?
Yes, it means diamond-like vehicle. It's like immutable.
Crystalline, hard.
Hard, yes. And that's where instead of, the two earlier schools, they tend to see negative thoughts as the source of all suffering, like desire, hatred, grasping.
Rejection,
These are considered poisons which you have to regulate and eventually overcome in order to develop positive thoughts, etc. That's basically their approach.
Sure.
The Vajrayana is quite different. It's quite the opposite in some sense. They say, don't overcome your anger, but learn to embrace it and transform it into a path, into your spiritual path. So too with desire. And the way they do that is, basically, to put it in a nutshell, you mobilize the physiological energy associated with anger and desire and strip away the cognitive negative thoughts associated with, disassociate the two, maintain the physiological energy generated by desire and anger, trap them and localize them systematically in different parts of the body called the chakras, which are simply networks of nerve systems at critical points in the body. Trap that energy, and through breathing and yoga training, you learn to channelize that intense energy up the chakras, one up like at the navel, for instance, and then use that to gradually transfer that energy systematically, depending on the state of mind or inner realizations you have achieved to the different chakras eventually. And the idea is that will unify the masculine and the feminine energy that we all are embodied. And when those two unite, they give birth, just like when a male and a female unite, they give birth. Similarly, psychic energies, when they unite, then they give birth to creative, what is called the creative mind, which allows you to become the deity itself. you yourself become the Buddha, so to speak.
So instead of leaning away from things that might be tempting or grasping or detrimental, you lean into the things, learn from them, and they transform you.
Absolutely.
Oh, it's
It's
wonderful.
yeah.
It sounds very different than anything
Very
I've heard.
much so.
That's
Very
wonderful.
much.
So at some point, your path changed. You, because you're clearly here in the U.S. now, you're a faculty member and a psychologist at UCLA. What was that change about? Why did you decide that you no longer wanted to remain a monk?
Well, that was because as I went to school and then decided to work in the United States, I began to feel like I couldn't really sustain my vows for, without a monastic support system. And also for the number of years I had been away from the monastic structure and order kind of, I think, played a big role. And my changing perception of because of my personal psychotherapy and own evolution as a person in a more modern and lay context, I think without fully being conscious of how much they were impacting me, I suddenly found myself like deciding to leave the order.
So let's dig a tiny bit into some of your interests. I know you're, of course, a research and a clinical psychologist, and I believe you have a lot of focus on anxiety.
That's right.
And also some fear and some other things. How does anxiety fit into this framework of these passions that are potentially things we learn from or transform us? Is anxiety a stuck place in your perspective of suffering, or is it something that is a process that we are working through to transform?
From the Vajrayana perspective, you could kind of taking the broad premise of how to work with emotions, particularly negative emotions, and transform them into positive ones. You could say, though it hasn't been specifically done with anxiety or fear, you could apply that principle. You could find a way to disassociate the negative cognitive and affective state associated with fear and retain the intense physiological energy and arousal, basically the arousal associated with fear, and then learn yoga and breathing techniques to interfere with the flow of that energy and use it strategically to enter into the desired chakra points. There are 7 chakras on the body. So, and that could lead to the chakras being activated into a harmonious and synchronistic way, which leads the brain to, so to speak, to kind of synchronize and produce insights and perceptions in a very different way than the way you were experiencing a month before.
It's very interesting. So, I mean, I work with people's brains. Many people have anxiety, and I sort of feel that anxiety is, to some extent, a healthy phenomena. I tell my clients, if you're being chased by a tiger, be anxious. Exactly the right response. But humans are, we can catastrophize and think of what could go wrong. And so, from my perspective, when anxiety is a problem, it's when it doesn't ramp back down when the environment is no longer threatening or stressful. So when you work with clinical clients who have a lot of persistent or triggered anxiety, is your clinical approach one that helps them lean into these experiences and learn from to transform, or is it more getting control of your mind? Where's the clinical sort of path that reconciles this approach?
In clinical use, it seems to be much better to use the mindfulness model and work primarily to using the technique of how to be fully present in a non-judgmental or accepting way, as well as in a non-reactive way your anxious thoughts and fearful feelings. And to do that, what I do is first try to teach clients to first learn to create mental, what we call mindful distancing from your thoughts and feelings. And that really involves teaching them how to get a sense of a spatial distance of you yourself as the observer from your thoughts or the sensations. Let's say in an anxious patient, you might have a sense of gnawing, tightness in the stomach. So we teach them to get a sense that you are the observer. The experience of sensation is there's a spatial distance between yourself, who's the observer, and what's being observed. And we train in that. And then that's a way to learn people, to teach people to watch their thoughts. And through pausing, we teach a lot of pausing when you watch, and if it's getting too much, you just pause for a while, connect back to your abdominal breathing, regulate your breathing, come back to the watching again. And the more you can watch your thoughts unfold, that's one of the key elements I notice when a patient hits that ability. That is where the transformation of mindfulness occurs. Even though mindfulness provides other things as being non-judgmental and accepting, but clinically, in a measurable way, I think that's a key element.
So this essentially sounds like you're teaching people how to not identify with their processes quite so much. Like the I is not tied into the anxiety as much.
Absolutely. As you know, with anxiety, when you have a fearful thought or a feeling, there's no differentiation at all. Or, the I and the observer and the observed are disidentified. They are seen as one. There's no, like when a person has pain, for instance, the pain, they don't say, my foot hurts. They say, I hurt. So the Buddhists say that the first thing is to learn how to disidentify the two. And then you can bring to bear the full potential of being non-evaluative, and being non-reactive becomes much easier. But if you don't learn that initial skill of watching from a distance, just like watching a video of yourself on a screen, if you don't learn that skill, then trying to be non-judgmental and non-reactive become really a kind of a forced or induced attitudinal state, which has benefits for sure.
Fake it till you make it.
Yeah, right.
So it sounds like, and again, I'm not the Buddhist scholar in the room, so please correct me if I'm wrong. It sounds like this disidentification would lead to essentially equanimity, being okay with how things are, even if they are not appetitive, even if they're uncomfortable. Is that somewhat accurate?
That's accurate in the sense that once you identify, and then you can fully accept the anxiety. After watching it, then you can accept while being fully present to the anxious thought or feeling. And you can accept it, and then that turns into tolerance of it. At that time, then equanimity, the first elements of equanimity begins to unfold.
After you can tolerate the suffering.
Yeah. And then it leans towards becoming a positive, experience. Because then you can say like, okay, this pain is on a scale of 10, it's 7. And yesterday it was 5. And you can generate equanimity about that information. Whereas now it feels like, yesterday was 5, today is 7, it's getting worse. So this technique is not working. There's a negative spiral that happens. Equanimity helps to check that.
Interesting. And, from a clinical psychology perspective, things like depression and anxiety, they seem to have this quality that robs you of foresight. How you're feeling now is how you think you are feeling forever.
That's right.
And it's very difficult to go, okay, shift does actually happen. The moment, how I'm feeling right now is not how I'm going to feel tomorrow or the next day. That seems to be a easily lost perspective when there's mood disorders or stress disorders.
Right.
Sounds like this would be a way to sort of re-educate the brain about the fact that there is, that things do change.
Very much so. And, there's like studies which show that when people who have had depression and they've recovered to a certain degree, and to prevent relapse, if you take those subjects and train them in being fully present to their sensory experience in their body, what they notice is the right anterior insula begins to activate. And that insula is associated with awareness of your sensory experiences. Whereas in the control group, what they found was that it didn't activate.
Interesting.
And therefore they were more likely to recall past negative experiences associated with their depression, which in turn showed that they were much higher, more likely to relapse.
Interesting. There's some research on the right insula in aging medicine. Older adults that meditate are spared a loss of the right insula. The cortex, of course, thins as we age.
Right.
I also seem to remember that if you do TMS on the right insula, people spontaneously stop smoking cigarettes, or at least temporarily. So something about the body sort of feeding the body and aware of that thing.
Yeah, I think there's the ability to regulate your aversion to unpleasant sensations versus also appears to be very critical here. If you develop, and that there's research with the people who meditated 5 years or more, and what they found was that when pain was induced in them, they reported much less pain than the control. However, when they looked at the brain, they found that the pain areas were very active as the control.
Interesting.
And what they found was, however, the anterior cingulate cortex, which kind of regulates your reaction and responses to sensations. What they found, that was well controlled. So what they were doing was they were able to regulate their aversion to pain.
Interesting. Even though pain was still physiologically the same.
Physiologically was being activated in the body, the affective and cognitive interpretation of the pain, that was
that's
controlled.
Lovely.
Yeah.
That's such a great finding. Of course, also colleagues at UCLA, Naomi Eisenberger and Matt Lieberman, found that the right frontal areas that perceive physical pain are also the same areas that perceive emotional pain. So heartbreak and loss actually does produce pain in a really physiologic way, which seems like it dovetails pretty well with the clinical work of treating
very
things.
Much so. So like to cap on what you said earlier, I think is very critical. There's something about if you learn to sense your bodily sensations, there's something about that has an impact on our mood.
Yeah.
Because there's some preliminary research which shows, for instance, that the the stomach contains like over 100 million neurons.
Yeah.
And these neurons appear to be having some impact on the mood state directly.
These are serotonergic neurons too, right?
Right.
95% of the serotonin's in the gut, not the brain.
Right. So again, if you have a gnawing sensation, which most anxious people do, like or if you take most anxious people on a Sunday night just before going to work, even though they busy themselves with laundry or catching on a late night show, etc., many of them will report feeling a gnawing sensation in their chest or stomach because it's an anticipatory or response to the next day. So learning to use like mindfulness to regulate and be aware of sensory experiences such as that could play a big role, I think, in better helping anxious people to not anticipate or not expect that Monday is awful, etc.
Yeah, it seems very, very crucial. So by that same token, I would guess that people that are habitually anxious or tend to become anxious may not have as much of a sense of their fluctuating physical sensations. They might not be as checked in.
Very much so, I think, because they are locked into ones that are uncomfortable and immediately seek to avoid it by distracting themselves. So they are probably not attuned to other bodily sensations, because even when they are attuned to the distressing sensations, they don't have the mind narrows, their attentional field narrows, and they are not able to pick up other sensations which might be quite pleasant, such as the fact that they feel the upper body feels a little more relaxed, etc., or they feels more relaxed. They are not able to pick that up because they lack broadened. They can't broaden their field of attention, which is a very critical skill and which anxiety tends to completely shut down.
Sure. Interesting. So is this mindfulness? Is this meditation? Let me actually ask you to maybe unpack for me the difference. Are mindfulness and meditation the same thing? Are they subtly different? Do they overlap?
They are different in the sense that, there are only two broad categories of meditation.
Okay.
One is the concentration meditation,
shamatha,
single, and the other is the insight.
Vipassana.
Yes, that's the broad category.
Okay.
Everything else fits into that. Now, what's happened is when the Buddha taught mindfulness, he taught it primarily as shamatha. We don't hear in the original Pali text much of insight as being associated with mindfulness.
I did not know that. You would not know that going to any insight tradition center in West LA, certainly.
Right. If you look at the original, suttas, you'll find that that's the case. And that's more like evolution, I think. Later disciples begin to, the latest disciples begin to interpret what the Buddha meant. And there was a lot of confusion among themselves. So they began to define things which more clearly than the Buddha did. And as a result, numerous schools began to evolve within the order. And what you find is that even in the Theravadan tradition of mindfulness, when they began to take it more towards, they became more enamored with the Vipassana aspect of it, because it was more easy to do. The shamatha, single-pointed concentration on the breath for hours, was just too demanding.
Sure.
And all Buddhist school kind of began to shy away from it, including the Tibetans, including the Theravadins to a certain extent, and the Mahayanas to a certain extent. They began to shy away, and they felt more enamored. The idea of just labeling your thoughts, disidentifying the self from them, and then letting thoughts come up, watching them arise, and that was much more appealing to them.
Yeah, it's certainly more enjoyable.
It is.
It can be. I have my own training is sort of in insight tradition, against the stream, Dharma punks, which is, my understanding is that's sort of descending from the Theravadan way of doing things. It's a little more Vipassana based. And then, of course, a lot of that came out of the late 70s, John Kabat-Zinn, Joseph Goldstein, Jack Kornfield. That was essentially bringing the insight tradition to this country. Was not to denigrate it, but sort of watering down a little bit the Theravada techniques.
That's right. Right.
And now modern mindfulness, MBSR, mindfulness-based stress reduction, which of course came out of John Kabat-Zinn work at UMass Medical, that seems to be even a little more separated from the roots of Theravada, Mahayana, etc. Do you think anything is lost today in how mindfulness is taught to Westerners, especially in this country? Are we missing something when we do directed attention and just watching things? And
right. I think it's a very good start. The way the clinicians and researchers have kind of fine-tuned the original teachings of mindfulness into a form that is, patient-friendly. It's culturally relevant and appealing. The danger is, of course, then to not go beyond, in Buddhist meditation we have this concept. You need to learn how to not under-apply a technique, but also you need to be very conscious of over-applying a technique. So let's take the concept of non-judgmental. It's a great way for an anxious person who feels a lot of guilt and has a lot of negativistic thoughts about himself and others to kind of learn to use non-judgmental to overcome that. But after that, he has to also learn to make judgments. Because in real life, he has to make choices, like which school do I send my child to?
Right.
What are friends? What type of friends should I cultivate?
So non-judgment is not apathy or fatalism.
Right,
It's skillful non-judgment.
Right.
Interesting.
It's a skillful non-judgment, but for clinically, for clinical patients, it's good to teach non-judgment. I found that it's very good strategy to teach them to reduce their excessive negativistic thinking. But once you've done that, the idea is then how to help them to make constructive, beneficial judgments in their relationships, in their lifestyles, in the type of thoughts or decision-making processes. So here I think there's always a danger for people who do MBSR to over-apply non-judgmental or over-apply being accepting.
Perhaps on the other side too, I have we do neurofeedback a lot at my center, and we teach mindfulness, and it's generally this sort of insight, low-key technique-based thing. I have one client who's been doing a lot of neurofeedback and getting very deep in his meditation. And he, about 6 months ago, found absorption techniques. He's doing mostly samatha. But he's getting essentially the jhanas. He's getting these incredibly profound, seeing light, shaking body, having absorptive experiences. And he's not somebody who's been meditating for 20, 30 years. It's more like a couple of years. And as we start to exercise his brain with the biofeedback, suddenly his meditation practice just took off. And now he's getting almost stuck in these jhanas, where I wonder if going towards the strong absorption, the strong single point awareness can also potentially be a trap a little bit. It can get you stuck in the experience of that. Is that sound accurate?
Absolutely. That's one of the main arguments the Tibetan Buddhists would make for Vipassana. And, they would say that you should. That's the reason they'll say. When I say to the Tibetan practitioners, why don't you practice shamatha? That's exactly what they will say. Well, shamatha is, you get into this very blissful jnana state, and you become seduced by it. That everything else seems, you tend to devalue every other practice, and that's a stuck point. There's actually a story where the gods, in the Buddhist mythology, they are in a state of this blissful state of single-pointed concentration. So the Bodhisattva, who's the, Buddha, who's out of compassion comes before the god, who's in that state, and snaps his fingers and wakes him out of the jhana and exposes him to the reality of his world. And that serves as a cue for that God to then begin to overcome his desire for this blissful state.
And so he's even helping the deities to improve.
And go into a Vipassana state.
Interesting. It sounds like that's a teaching story, I think, huh?
It's
wonderful.
Yeah.
So tell us about what you're doing with research these days. Fear re-consolidation. So from my limited understanding of trauma and fear, this sounds like you're working with people who have experienced profoundly traumatic or anxiety learning events.
That's right.
And then the reconsolidation, for folks that aren't psychologists in the room or listening, consolidation is the act of storing memory. Reconsolidation appears to be something that happens when you experience an old memory. You take it down off the shelf look at it from many directions, and then put it back into storage after you're done, which is probably why therapy works in general for things like stressful and traumatic experiences, because you can re-experience something in a safe environment and put it back with less triggerable stuff. What is it you're exploring? I mean, research is always very, very narrow. So what aspects of that are you really digging into?
Well, there's, over the last couple of decades, they've begun to find that when you recall information such as a fear information from long-term memory, which has been consolidated in your long-term memory, when you recall it, there's a short window of time, like right after the recall of that memory, so whether it's traumatic or any other anxiety-related issue, there's about 2 to 4 hours window of time where that information has to be reconsolidated because it becomes unstable when you're recalling it. And if you look at a person who has trauma, when you ask them, you can see how they have difficulty recalling the entire spectrum of the trauma. Now, within that 2 hours or to 4 hours, if you can intervene with the appropriate novel intervention, because the original memory of the trauma is unstable, if you interject it with the key word is here, appropriate novel treatment, such as, let's say, standard extinction at that time, it's been shown that the fear is erased. So they actually have tried out cases where, let's say, someone has an automobile accident and is rushed to the emergency. They've actually injected, protein synthesis inhibitors, which during that short period of window of before 4 hours, and they found that the person pretty much the fear is erased. It doesn't turn into a disorder and so based on those studies, what I've been looking at is, can we use standard extinction as the novel intervention to see if fear is erased, which there's good evidence that it does erase fear. Unfortunately, with just standard extinction, the fear returns under various conditions. So what I did was then create the primary experimental group where they, in addition to standard extinction, they would get a 90-minute training in mindful reappraisal training. And our hypothesis is we'll see if that ensures erasure of fear.
Are you seeing some early results that would suggest?
We are just beginning the studies.
Okay. It sounds very promising. It's very exciting stuff.
Right, it is.
So, what else have you been doing with your life in the past few years? I think you've written some books. Would you like to tell us about those?
Yeah, I've written some books, and I've published some peer-reviewed journals as well. And done a couple of research. I've written a book. In terms of the book, I've written a book on meditation.
Wonderful. Yes. I did not know that.
Yes.
What's the title? Tell us.
It's on meditation, introduction to meditation.
Great.
Yeah.
Great. I will pick up a copy.
Okay. Thank you.
Yeah. Wonderful. So, Dr. Rapgay, so lovely to have you here. It's been a year or two since I've actually seen you face to face. I feel like I'm poorer for it, so it's nice to get a nice catch up on you, certainly on air. If folks are looking into these clinical areas, research areas, they're interested in Tibetan Buddhism, they're interested in you personally, where can we find you? Where can we track you down and see what kind of work you're doing, what kind of research you're doing?
Well, I've just started developing a website, so they can go to that, and it's www.integratedmindscience, it's all one word, .org.
IntegratedMindScience.org?
Yes.
Great. Wonderful. And you'll have some of your publications, some of your philosophies.
Gradually I'll put it, yes.
Great. Well, we will go there and look for that. So again, thank you so much for being a guest on our show today. Our Head First listeners, I'm sure, are having their minds blown by just a few of the very wise and subtle things you said. So it's very much a treat. Nice to see you. And folks, take care. This has been another episode of Head First with Dr. Hill. Our guest today was Dr. Lobsang Rapgay. So take care of those brains, and we'll talk to you soon.
Thank you.